So, as I said, you're going to hear a bit more from me in a minute. I've got colleagues from North East Essex, so Laura Cook from North East Essex, and Alan Hicks from West Essex, and Jane Marley, who works on behalf of all of us, both in Essex and wider across the region, coming up to talk to you about some of the work we're doing locally. I think it would cover some of the questions that were raised during the previous section in terms of how we're doing things. We have got a bit of a gap in that we were hoping Jasbinder would have explained to you all the national picture, all the national must-dos and all the things we're all working on together, because there is a lot of consistency in terms of what's happening in the different areas, some of which is driven by the national requirements. So you'll be hearing all about that next. But I guess just in terms of the things we are all working on together, just in case you hadn't got the gist of that already from the presentation, online consultations is a programme for all of us. The NHS app is a programme for all of us. Hopefully you've seen that, you've used that. Improving access to data and analytics. We've got somebody talking to us later about some magic data stuff, but that is absolutely a requirement for all of the CCGs to make available to primary care networks and general practice, access to data and analytics support, and I'm sure I've forgotten something. Information governance support. As I've mentioned, there's work across all sectors to look at how we join up records across health and social care more broadly than primary care. So I've probably forgotten something. Someone will remind me in a minute, and I'm sure Jasbinder will cover it all. But can I invite up to the stage Jane, Laura and Alan, and we'll go through the next presentation. So as I should say, we maybe met a couple of weeks ago to kind of compare and contrast what we were going to say, and we had so much commonality, we thought you probably didn't want to hear the same thing 3 or 4 times over. So we've combined our presentations. Hopefully it'll fit well together. If we miss anything as a result of that, obviously ask that in the questions. And but I guess we'll be hearing a bit about some of the stuff in particular locations, but we are doing similar work across the whole of Essex. So if it's not your patch and you're hearing someone speak about it and you're interested in what's going on in your area, obviously get in touch and we'll let you know. So to get started, my first slide. So when I was a kid, my favourite TV programme was a show called Tomorrow's World. So for people who don't remember it, Tomorrow's World was a BBC programme about new developments in science and technology. However, because I was 8 years old and because I'm also quite literal, I thought it was basically like the news day early. So the things that came up on there would be they're out in the world tomorrow and I could use them and my family could use them. And for me, I think some of our digital programmes in the NHS sometimes feel a bit like that. So something's announced one day and all of a sudden the next day we're all supposed to use it, our staff are all supposed to understand it, and our patients are supposed to think it's the greatest thing that's ever happened to the NHS. So I can see a few nods around the room, so I'm guessing that's not the only person who feels like this. When I was asked to lead the primary care digital programme across Mid and South Essex this time last year, that was just something I wanted to really keep in my mind. How do we make this a piece of work that works for everyone, that doesn't make people feel like all of a sudden something's announced and we've just got to do it without thought and care and attention to how we do it and how we do it well. So when I was asked to take up this piece of work, the brief was quite broad. In Mid and South Essex, we'd just signed off. Oh, my slide's gone off. We just signed off our shared primary care strategy. And I guess probably the message to us in the CCGs and to local practices was kind of digital was important, but we weren't necessarily sure. We all knew what we were trying to do with that or where that was going. We didn't have clear plans in place, and if you read the Mid and South Essex primary care strategy, it basically says, we know this stuff is important. I think there was a slide in the Slido questions before about do we have strong local leadership? Well, our view last year was no, we didn't. I think our view now is that's growing and we're building it. That's partly myself, it's partly some of the clinical colleagues I'm working with, it's partly the work we're doing with Martin and other people in the STP. But at that time, we didn't have a really clear plan what it was or how we would do it. We just knew we had to. So essentially the task was for somebody to take responsibility for doing some of that thinking and pulling together other people to do that thinking about how we would make digital work for patients from over 160 GP practices of very different shapes and sizes and ways of working. So during the session, the 4 of us are going to talk about how that's working in different areas. There's, I think we've all been given kind of similar tasks. We've all got different backgrounds. If you look at your agenda, you'll see we've got different job titles. We've got different things that we kind of have our heads around and other things that we're involved in. But the focus of our session is going to be to talk to you about some of the changes that are happening now and some of the support that's available for you, your staff and your patients. So what I want to do to begin with is just share some facts and figures with you. Who uses digital? So 22% of people in the UK do not have the essential digital skills needed for day-to-day life. So that's quite staggering. But I think what people quite often seem to assume is that that's the elderly population, and actually the figures show that's not true. So about half the people offline are actually under 60. And if you look more into the figures, that's the people who are disadvantaged in life in other ways. So this is just an overlap of other social circumstances that those people are in. And half the people who are offline come from a low-income family. So when we think about how we do digital, as people who work within the NHS and have responsibility for reducing health inequalities and providing a fair and equitable service to everyone, we need to think about how we do this in a way that helps everybody, not just the people who are really tech savvy or really into all the shiny new kit. One of the things that's contributed to such high numbers of people who do use the internet is smartphones. So probably everyone's got theirs with them today. I've got two. And between 2012 and 2017, the number of people aged 55 to 75 who had access to a smartphone or tablet went up from 1 in 4 to 3 out of 4 people. So my first question for you is, working in general practice, what difference has that change of behaviour of your patients and staff meant to you? If you've got 3 out of 4 people coming into your practice who've got access to a smartphone or tablet every day between 55 and 75 years old, how has that changed what happens in your surgery every day over the last 5 years? And has that meant you've been able to stop doing anything? We've spoken about the gift of time. Has that given you any time back, or has it created more work because different things are happening, people are coming with different questions? We've heard about the TOPOL report. Becoming digitally disadvantaged isn't just something we need to think about for our patients. More than half of UK employees do not have the digital skills needed for work, and 2/3 of people in the UK in the workforce do not receive skill support from their workplaces. So, we've already heard a bit about the TOPOL report. There's a very specific statistic in there. My button works. Which says within 20 years, 90% of NHS jobs will require some element of digital skills. If you're working in general practice, I think that's probably 100% of people working in your practice already. So clearly that's something that we need to pay attention to if we want to be an employer of choice and if we want to attract people to come and work in the NHS and to stay in it. Right, my next question for you. So, going to ask if anybody knew the answer to how many appointments happened in general practice last year in Essex, but I pressed the button too quick. So, last year there were over 9 million appointments in general practice in Essex across Essex. That's a staggering number of appointments. I don't know, those of you who go to meetings where we talk about, or read the newspapers where they're talking about how many people turn up in A&E because they couldn't get a GP appointment, they're normally talking about maybe 50 people a day at our local hospital. We're offering 9 million appointments a year. And if you look at some of the other figures that talk about how quickly most of those appointments are, the majority of those appointments are same-day appointments. So that's, just a sense of the scale and the opportunity to do things differently, but also the scale that we're trying to impact on how people work. So there's a lot of change needed to impact on the way 9 million appointments are delivered. So put your hand up if you use the internet. If you use the internet to find information, if you use the internet to do shopping, if you use the internet for your health, keep your hand up if you've used it this week, keep your hand up if you used it this morning. So that's pretty much everyone. So do our patients. So the most recent GP patient survey results, and I've had a look at, does that look different across Essex, across the different patches with different demographics, but it's pretty much up there. The most recent GP patient survey results show that in our area, in Essex, more than 30% of people look online for information or advice before they book an appointment. There's some other figures in there about people who ask for advice from their family or friend. I know if somebody in my family asked me for advice, I'd probably go, hang on a minute, look it up on the internet for them. So I suspect the people who are getting information from the internet before they book appointments probably a little bit higher. But just thinking about that, I guess I just wanted to ask, if there's 2.3 million people in Essex a year looking for advice or information online before they book an appointment, what if some of them found what they needed while they were looking and then didn't book? What would those numbers be? So if 1 in 1,000 of those people didn't go on to book an appointment, that'd be 2,800 appointments a year freed up to do something else in general practice in Essex. So those of you who work in surgeries, if I was to tell you had 2,800 extra appointments to put in your appointment slot, just think about what that would mean. And I know that's across the whole patch, but clearly that's a big number. If 1 in 100 people found what they need, that number goes up to nearly 30,000 appointments. So if we're thinking about what digital means, there's lots of people here to talk to you about clever technology to do this and clever technology to do that. But even if we just think about something that we all use every day, the internet, there is a huge opportunity in terms of how people use that to impact on the way that our services are provided. So my next question for you to think about is how many of the patients that come into your practice could have got help elsewhere? Do you know that? So 2 key aims of our primary care strategy were to reduce workload and increase capacity. I don't know whether you feel like the way you're using digital tools in your practice at the moment feels like that. I know when I went along to some of the demonstrations of the NHS app to some of our local groups, there were definitely some people in the room who had looked as though the idea of yet another tool was a complete heart sink moment for them and just yet another piece of work for them to do. There was some enthusiasts in the room, but there was definitely a lot of people going, oh really, have we really got to do this? So all of this might be why NHS Digital have recently reported that they see an 8 a.m. rush for the NHS app. So I don't know if any of you read this blog. It's a really interesting account of how introducing a digital tool into the workplace, but actually making no other changes at all it means is instead of ringing your phone lines at 8 o'clock, patients will go on the book with the app. And I suspect some of that's about when appointment slots become available. They've got some hypotheses in their blog about why that is, but certainly some of that's too. So we know that the digital tools on their own are not going to save time for practices. They're not going to increase access for patients. We're going to have to change the way we work as well. And obviously today's all about that. So my next question for you is, in the practice that you work in, do you know who is responsible for making sure you get the most of the digital tools available? Have you got a digital champion, self-nominated or official? Just have a think about that. Who is the person in your practice who makes sure you're making the most of this in your area? So this is where I'm going to fall down a little bit. One of the things Jazz Binder would have, I'm assuming is going to cover, is the fact that from earlier on this year, all of our practices are now expected to make 25% of their appointments available for booking online. We've had some questions to Alison about what that means, how we make sure that those appointments are used in a way that's useful for patients, means they get to the actual right member of staff, don't end up booking into the wrong thing because they're not sure what they're booking for and end up wasting everybody's time, the practice and the patient. But do you know what it would mean for your practice if you put not just 25%, but 50% or 100% of appointments online to book? If you just opened your whole book up and let the patients book what they thought they needed, what would that mean? Would that work for you? So what I would like you to think about is, how are you going to find out what is the right number of appointments to book online and what is the right mix of appointments to book online? So some really good examples, people putting all their flu clinics online. It's quite straightforward, it's quite easily understood. You've been invited to your flu clinic appointment, book into the flu clinic. You know, hopefully you're not going to have too many patients getting that wrong. Clearly there's some other things where it's much more complicated in terms of who they need to see and who the best person is to meet their need. But just have a think about whether you know within your practice what you're aiming for. The 25% is a target we've all been given, but think about what's right for your practice. So I think that was everything I had to say my first point. I'm going to hand you over to Alan, who's going to talk to you about some of the technology that underpins all this and what we're doing to make sure that that's right and that works, so that when you try and use all this lovely great stuff, we don't have what we had earlier this week, which is none of us could do anything because NHS Mail was down. So if you could solve that, Alan, that would be great.
So each of the CCGs has its own digital IT or digital team, but that may form in different ways in terms of if it's a separate IT team, separate digital, or they could be combined. Some of the work that we're doing at the moment, especially around the national mandatory requirements, the estates work in terms of site moves and new developments, managing the IT suppliers, working with the CSU to make sure that we get the most out of the contract. And also, when any of the work that we do carry out, we make sure that we work closely with our information governance team, Jane, Ian, to make sure that all of these meet the requirements. So what you can see now is basically a list of work for the next 18 months, or the planned work that we'll be looking at, and some of the projects and key drivers for us for this year. Some of these will be familiar to you, such as HSCN, which I know currently we are working through for a completion around April. There's the phase 3 of the GP migration, which to you at the moment you would probably see that as a Windows 10 upgrade that's making its way around Essex. But also including in this is to replace key switches, UPSs, to make sure that the infrastructure that sits behind underpins all of this, gives you the service and the support that you need to make sure that the equipment is going to keep you up and running. Some of the others, the GPIT Futures, this is the replacement of what was the GP SOC framework. Over the next year, we'll be looking to do a reprocurement of those services between January and December. And in the meantime, we will be putting in transitional agreements with those providers to make sure that your services continue, clinical systems and other supported services that you use. There's a new primary care and GP digital service operating model for 19 to 21. This is a new release of what you will probably know it as the GPIT operating manual. That's now released, and then what will follow will be a new practice agreement, which we'll be looking to do very shortly to add to your practices. I could talk for hours about what's on this list, but I just wanted to pick up on the key points really. And if there's any questions on that, let me know. I'm just going to introduce Jane Marley to talk about My Care Record.
So for practicing West Essex, unfortunately, I'm probably preaching to the converted here. My Care Record was developed 3 years ago and rolled out 2 years ago in West Essex. It's actually not technology. So that's the main thing I want to get through today. My Care Record, wherever you hear it, is not about the technology that sits behind. It's actually the communications campaign to patients and to professionals, and the IG framework that sits around it. So it's making sure that from a practice perspective, if you're being asked to share data for direct care purposes, that actually you're safe and secure. It was created in West Essex, originally with Princess Alexandra Hospital, where they started to develop a shared care record. What we did there was worked with professionals and patients. So a lot of, if you look on the stall over in the corner, all of the images were actually done with patients. So it's asking patients what they understand about shared care record. Most of them thought we were already sharing anyway, which I think is probably no surprise. And what terminology they want to use. We've had a rollout into Suffolk and North East Essex, which started on the 14th of October. So anyone from that area, hopefully you've got your posters, you've signed your sharing agreement, and you're starting to roll out. In Mid and South Essex, this will be the key information governance element and patient campaign to back the shared care record, which you will start to hear about over the next few months. It's not an IT project. There is terminology within the website and some of the documents that talks about it being a system. And the reason that's in there is because to explain it to patients, it's actually easier to get them to think about a system. So it might be a health information exchange, it might be a MIG, it might be a GraphNet solution, it might be sharing between System 1 practices in your PCNs. Patients don't understand that we have multiple technologies, so referring to it as a system makes it easier for them to understand. That does make it a little bit harder for professionals to understand because it's disentangling the systems from the product. There's a common information sharing agreement. So when we first started doing this, I was working in West Essex mainly, trying to get one information sharing agreement signed by 39 practices, not because the practices were digging their heels, but actually chasing up where was it, who was going to sign it, where's it going through, has it been through the LMC? It takes a long time. If you think about every time we want to share data from GPs to other organisations, again, it takes a long time. It takes your time, it takes CCGs, it takes hospitals' time. What we've developed is one sharing agreement. That means anybody who signs up to it can legally share data between the various providers for direct care purposes. It saves everybody's time. It's easily updated, so if we've only got one, when we have new legal requirements, we can just update it one. You've not got to update multiple, and you don't have to keep signing it. And it removes the need to ask for explicit consent. So under GDPR, we actually have a better reason, or a more legitimate reason to share, because there is an element in there that says we don't have to ask patient consent. As long as we've informed them what we're doing, which is where the posters, the websites come in, then you can share for direct care purposes. It's a comprehensive communication programme. It's being developed more and more, so as more STP areas are coming on board, we're looking at it and getting patients to look at it and make sure it makes sense. Benefits from a patient perspective. So I'm a patient in West Essex, so I live in Harlow. Most of the time, if I was ill, I'd probably go to Princess Alexandra, but I might not always, so I could end up anywhere across the patch. Our patients don't stay in the area that they live. So by having a brand and a communication campaign for patients that is the same across Essex and eventually across the east of England, actually means they're not getting a confused message. So it's one consistent message, they understand it. It's easier for you guys to explain it, and it's easier for the patients to understand. Benefits for you as clinicians and providers. It's easier to share information. So GDPR actually does make it easier for us to share information. The difference is we need to keep the patients informed. So as long as we've got that wraparound, we can share. We will still get patients who don't want their information to be shared for one reason or another, but it's about talking to those, the minority, about why and what their concerns are, rather than thinking nobody wants to actually share their information. It gives staff the confidence to understand that the technology behind it is secure and it's safe, and it supports new ways of working. So in West Essex, we actually use the MyCare Record sharing agreement to share between primary care networks. So we don't have a separate sharing agreement. So it does mean you've got less paperwork. It saves time, cost and admin. If we think about, I think on System 1 and on EMIS and the other systems, there are so many different codes for things like opt-outs, opt-ins. But we don't need to worry about that going forward. It just saves that time. And it's about being consistent across the system from a patient perspective. Less reworking, saving time, easier and quicker to introduce new systems. If we've already got the information governance controls around things, when the new system comes in, we make the system fit the information governance controls. And that's where the work with Alan, Laura and the other digital teams comes in.
Hello everyone, so you're now over to me and I'm going to talk about some of the examples where we've actually got some projects going live in North East Essex. So if you are a patient in North East Essex, hopefully what's on the screen now may look a bit familiar to you. So as part of our online consultation project, we got some GPs to do some research on what they'd like to use, what products they'd like to use. And this was one of the favourites that came up. So we're currently piloting this. It's a product called Footfall, and it's they've called it a digital practice. So the idea, I'm going to go on to the next slide and explain what it is, but if you just remember that slide, there's two sides to it. So on the left-hand side, you've got all the information you should have about the practice, and on the right-hand side is what's known as the digital practice. So obviously every practice website has to have its mandatory information. It has to have who its staff are, what their opening hours, what their addresses are. So that's on the left-hand side. That can be changed and tailored by a practice, so we can add information that we can change it. This is what's called the digital practice. So this is all touchscreen enabled, so it can work on tablets and iPads and any other, I'm sure there's other technology available. I'm an iPhone, Apple person. So this is a standard approach and a standard look to every practice in our area. And behind each one of those tiles is the ability to either ask a practice a question or to self-serve, because actually what we need to remember here is that we need to be starting putting some of the onus onto patients about looking after their own care as well. So the idea of the website is, as well as promoting online consultations, it also enables the patient to look after and treat themselves as well. So these are tailored to each practice, so the look is the same, the feel is the same, but what's behind each tile could be different. So in the Wellbeing Centre, it promotes you to local services such as Alcohol Anonymous, homeless charities, and obviously that's localised for each practice because of where you're located. What can you do on there? So you can make appointments, and that always takes you through. That's not a new system, that takes you through to existing systems. So if you've got your PACS, your patient system online, it will take you to that. You can cancel appointments. Again, that's done within the system that's all there. This isn't about reinventing the wheel. This is about a front-end application that will point you to services that are already in place. You can order repeat prescriptions, you can ask questions, and that can be expanded depending on how your practice works. So the standard is you can ask reception, GP and a nurse. If you have a physio on site, if you have a pharmacist on site, we can put those options on as well. So again, rather than sitting in a call, you could ask that question. As a patient, you do have to tick, as you're submitting that question, that it isn't urgent, because obviously if you're asking a question and saying you've got chest pains, you're not going to get a response within an hour to say you should have actually phoned an ambulance. So as a patient, you're committing to saying this isn't an urgent request and I'm happy to wait 2 days for a response. You can also do things like request sick note and fit notes, which again previously you would have had to sit in the call queue system for. And you can register as a new patient. So you can, instead of going in and having to queue and wait, you can present all of that online. So to assess the impact of this, obviously what we had to determine is, are we actually just creating another avenue for patients to get into primary care? We know demand's big, we know people can't get through on the phones. So we put a question on that patients have to answer if they've used the service. Now, they don't have to answer it, to be fair, but we've found that the response rate for the online questionnaire is about 75%, which is quite high actually, because I, for one, skip questions if I'm asked them. So, but the question they're asked is, what would you have done? Could you have not done this online? And in North East Essex, so it's live in 32 of our practices. We have 34. We're working on the other 2. We have avoided 9,317 phone calls, 5,618 visits, and 1,466 appointments. And I think it's probably fair to say that's not all practices going live at the same time. So that's practices going live over a year, and that's without little promotion. So we haven't gone out big scale and promoted this yet until we've got all the practices up and running. So what would that mean if we timed that over Essex, and what would the impact be? So that could mean using online consult could potentially save over 16,500 appointments a year in primary care, because we're giving a different avenue for patients to either treat themselves or to self-serve or to self-care. Now, in the NHS, and I'm culpable of this, we're very good at meeting a national requirement and walking away and doing the next national requirement. And actually what that does is it doesn't embed the change and the behaviour change that we need to get the uptake of these products. So as North East Essex CCG, we joined up with our local council. So we've got Colchester Borough Council and Tendring District Council. They already put all of their services online. They were very bold and brave and just did it without a lot of consult. And you can no longer order your bin without doing it online. You can't do your benefits without doing it online. they also already had a team in place called digital support officers, and they were out in the population providing training, providing support, and teaching citizens on how to use digital technology. And they either do that on a one-to-one basis or a group basis. So what was the point of me going out and doing the same? Because I'm just going to teach the same people to do something a little bit different, but actually online's online, and once you can do one thing, you can do the rest because it gains your confidence. So the digital support officers run groups, they do events, and they also do one-to-one training. We also then thought, well, actually, primary care waiting rooms is a great place because, let's face it, whilst we all would like to only be there for our 10-minute appointment, we're very often there for a little bit longer than that. So let's put the iPad into the GP reception, put some of the digital support officers in, and start training our patients to behave differently and to get them signed up and to provide that support and potentially book themselves on a group session. And we've found, it's about finding someone's tick that then makes them get online. So have they got a relative that lives abroad and they want to be able to email them? Do they want to be able to get their heavy shopping delivered to their door? And once you've got into that, then they're kind of keen to do other stuff. There's some further stats on here to what Jenny had, but 90% of households have internet access. 95% of 16 to 24-year-olds shop online. And actually I'm, again, very used to say, oh, old people won't use technology. I can say that because my parents did. So, but actually, we've found from the stats we're getting back from the website that the over 65 are the greatest user of the online services that we've put into primary care. And that's something to think, because we regularly go, well, we can't just have technology because the older generation aren't there. They are. They're probably ahead of us, actually. So again, I've kind of done the first bit. What if they don't have their own device? We have what we call digital access hubs all around in Colchester and Tendring now. So they're in the practices, they're in libraries, they're in community centres. You can go in there and you can get both your health services and your council services. So if you live at home and don't have internet, don't have a device that allows you to do it, you can go somewhere else and do it. And one of the big questions we get is, are you encouraging isolation? So all these elderly people who may live at home on their own, if they can then do their tech at home, do they not need to go out? Is that one face-to-face meeting they miss out on? Actually, no, because if they're being offered group sessions, they go to the library and then they then see that there's also a knit and natter or something else, so that it then kind of almost expands their social circle. The NHS app. This is my favourite subject at the moment, so I'm going to do a little poll on this. Can I have a hand raised of who has got the NHS app downloaded? Who's registered? Who's not just downloaded but is registered? Who's used it to book an appointment? Those that haven't, if you can form an orderly queue before you leave, we will have you downloaded, so long as you've got your driving licence. So, the NHS app and Patient Online, what's the difference? So, there isn't a lot of difference at the moment, it's probably the honest answer. You can go on both of them, you can book appointments, you can cancel appointments, you can order prescriptions. The difference is that the development roadmap for the NHS app is really good. And again, my NHS England colleague may tell me off for this, but normally we have a national initiative and we're like, oh, we need to do this, and there's no kind of enthusiasm about it. But for this one, for me, if we get this right, it can make such a difference to all of us. So the development roadmap for this is that patients will soon be able to have proxy access, they will be able to put nominated pharmacies in, they'll be able to link it to Choose and Book. So as a patient, it will absolutely be your front door to a lot of your online services in the NHS. It's relatively simple to log in. I say that because it takes about 5 minutes if you're digitally savvy. It probably takes about 10 if you're not. And what we're using is our digital support officers to do that with patients. So, because once you're in, it's super easy to use. As we've alluded, 25% of appointments need to be online. What we've suggested to all our practices is get your app downloaded and look at what your appointments are available, because you can see if they're clear. So taking someone's point earlier is, you book into the wrong clinic, it's then a massive administrative overhead to change that. look and see what it says, because actually if it says nurse appointment, we all know that you can have a 5-minute nurse appointment, a 10-minute, and as a patient, I'm going to book that and probably have booked the wrong appointment when I needed 10 minutes, but it was a blood test where I only needed 5. So getting the slots labelled correctly will make a big difference. And we've got a couple of practices, and I'd be happy to share the examples of how they've labelled their clinics to make it clear for patients when you're going online and booking those slots. And that means that it's then encouraged them to put more appointments online because they've built the trust in the system and they know that patients are booking appropriately. You can state your organ donation. You can see your record either in summary or in full. So it will be in summary if you haven't requested to have full access, but you can still ask your practice to give you full access, which you can do by emailing them rather than standing in a queue or on the phone at 8 o'clock to do it if you wanted to. So current sign up in Essex. So this is where it gets fun, people. So currently across Essex, 3,273 people have signed up, of which about 120 are in this room, I think we've just established. So kind of gives you an idea of where we're at. Where do we need to get to? So the target is 30%, which for us in North East Essex means we need to get 98,000 patients signed up to the NHS app. Hence why I don't let people out of the room if they've not done it before they leave. Now, the only way we're going to do that is to get people's trust in it and to get practices trust in it. So I think we're putting a lot of effort in North East in terms of gaining that assurance, making people see how tangibly it can make a difference. But 98,000 is a lot of people to get signed up. And I think across Essex, we're probably looking at somewhere near 500,000, if not more people we need to get on the app. So this is a little bit of a case study. I won't read it all for you, or hopefully I won't, I'll summarise it. So a friend of mine, sadly her mum died and her dad has many long-term conditions. She used to go to the doctors, order his prescription for him, go back, collect it, take it to the pharmacy, and the pharmacy then delivered it. So obviously, sadly, when she passed away, he was in a bit of a pickle because he didn't want to put the onus on friends and family. He didn't want to do this. So I went round and I said, right, let's get the app downloaded, which I do to anyone, to be fair, so be warned. We signed him up. We got him signed up. Within 5 minutes, he'd had the acceptance back from the practice to say that it was all signed up. And he can now order his own prescription on a Sunday night, and it is delivered to his door on a Monday evening. Now, it sounds quite stupid, but for him, he said, that's brilliant. It's given me my independence back. I don't have to rely on anyone. I can forget that I've ordered it, and I can log in at midnight and know it'll still be there in 24 hours. And it's simple things like that where, you know, someone said to me, oh, the NHS app's changed my life. And you think, really? But actually it does, because it allows people to control their own medical care again. And this is the last one, I think. So video consultation. You will see a stand at the back, this way, for GP and me. So the key word I like to use now is co-design or co-support or whatever we want to call it. But ultimately, it's taking someone's point earlier on the stage about how do you get buy-in? Because actually, me sitting in my ivory tower saying, you must do this, I wouldn't do it. So this is a product, it's a video consultation product that was designed by one of the GPs in North East Essex in one of our practices. The GP is sat at the back, Dr. Samsad. And it was about how will consultation work for him and his practices and his patient. So they've designed the software. We're about to launch it next month in 6 pilot practices. But it works because a GP designed it. So if I designed it and took it out, I wouldn't understand operationally how it would work and how it would impact on everyone. The sign up with every single one of our practices in North East Essex wants to use this product because the GPs are around the table, the nurses are around the table, the administrative assistants are around the table. They've all had an input and therefore they know it will work for them. And I think that's the bit I take away now every time is there's no point me sitting over here saying, we need to do this digital delivery. I'll come up with an idea. We've now mobilised a board that has GPs, nurses, secretaries on it, where we actually talk about the next developments and they're involved in it. And what we find is that brings the change. They take the change back out to the practices and the change in behaviours. the other good thing about this is GP and me have managed to get themselves on, I'll never get this name right, the new Digital Care Services Framework, so the new GP SOC, if you like, which means from a procurement point of view, they've been assured and are there. So please pay a visit to Farouk and Co at the back, who have got some little pamphlets for you to fill out if you're interested in their product. Thank you.
Thank you, Laura. So I've just got a few more things to finish. We've heard a lot about some of the kind of arrangements in place to improve the technology that you use, the speed of the technology you use, but also the confidence of your patients and staff to use this kit and to know that their information is safe. And also from Laura, some really, I think, very personal examples of how particular products can help improve care and help us do our jobs better. So, but whilst the opportunities are vast, obviously, I think we've commented the word confidence has been used a few times, and we are really aware. I think there's a question on the Slido about what the difference is between IT and digital. So for me, we can cover that a bit more in the question and answer, but for me, one of the things about that is that IT, I think Peter sitting at the back describes it as the pipes and wires and the bits of kit that you've got in your practice. That's how we use the word IT in the NHS. But digital would include the work Jane's talked about information governance and the change that's needed with patients. It might include some work around how we use data and numbers to understand what's going on. It might include how we use Facebook to advertise stuff to our patients. So it has a much broader application. IT is part of it, but it's not just about the kit that we've got. It's about the technology that people have got in their own homes. That's nothing to do with our IT departments. They've bought that themselves and brought that into their lives. So one thing I just wanted to cover, and there are some questions as well on the Slido about what support is available for people. One of the things I'm really pleased to be able to stand up and tell you about today is the Magpie tool. So Health Education England, in response to the Topol report, have developed an online learning tool called Magpie. We've been, because we've been talking to them about the work we're doing around digital tools and digital work in Essex, they've asked us if we can promote this in primary care in Essex, because I think people quite often find it quite hard to engage with multiple GP practices, but coming through the CCGs, we can share it with you all. So at the moment they're working with some trusts, but let's get this used by some primary care people. It's a pilot at the moment. It works a bit like Amazon or Netflix. So you go in, you answer 3 questions to get started, and then after that it will start to tailor the content to what you said you're interested in learning about, and also how you've said you're learning. So you probably can't see this very well. This is what it shows up for me. If you log in, it will look completely different, and if I go in a couple of weeks' time when it learns that I don't very often watch videos that are more than about 6 minutes long, I think it's probably going to look different for me again as well. So that's one thing I just wanted to promote for you. And then the last and final thing, there's been a few things mentioned throughout the presentation, but we've just done you a little action list, so you'll have this in your slide set. But as Laura has said, sign up for the NHS app. If you haven't signed up for it, or if you haven't made all your friends and family sign up for it in the way that Laura is doing, please do that. But also make sure you do go and look at it, what it looks like for your patients. My practice, it sort of looks okay. I kind of can get my head around the NHS technology, but 48-hour embargoed doesn't make a lot of sense to my partner or my mum when they go in and go, what's this appointment all about? So just remember, whatever you can see on your system, that's what people can see. Whatever it's labelled, and it might make sense for you and your reception staff, that is what patients can see. So if you want them to book to a flu clinic, call it a flu clinic. So it's really obvious what it is. But as Laura said, she's got some examples of that. I've just mentioned Magpie. As I've said at the beginning, the Topol report talks about the importance of us making sure our staff have the skills and ability they need to make the most of digital tools in the workforce. That's not going to go away. We are here today because we're trying to promote Essex Primary Care as a fantastic place to work. So let's make sure we're able to offer people skills training in our workplaces, and that would be one way that you can do it. I think there's some questions on there about, are people going to come out and talk to practices? The answer to that is absolutely yes. If you want us to come and talk to you, obviously it depends which area you work in, who the right person is to talk to you, but invite us in to talk to you. We've got clinical leads working with all of us as well. So if you know, if you think the staff in your practices would like to hear the clinical voice in that conversation, it's not just about us, but invite us in to talk to you on a personal level, your practice, your primary care network, or all three of them. We can only make this work if we come out and hear what's going to work for you. Online consultation, so Laura's talked about the products they're using in North East Essex. We've got a number of products in place in Mid and South Essex at the moment, and we are just in the process of finalising a contract with a supplier that will be launching probably either just before or just after Christmas. So let us know if you're interested. If you're not already using it, get on our list so you're the top of the list of people to be getting access to that. And Alan already has an implementation programme underway in West Essex. So if you talk to Alan, if you're in West Essex, if you're not on his list, I'm sure he'll be very glad to have you on that. And then just a couple more points, which is just to encourage you to have a discussion within your primary care network. So what's really obvious to me as I go around and talk to practices is how differently every practice approaches this. So just have a discussion within your practice about how you do this, what works for you, what works for your patients. Because I know in the area that I work, we've got GP practices sitting almost opposite each other with a very similar catchment area, a very similar patient demographic, and one of them might have 3% of people booking appointments online, and one of them might have 50%. So there's something, for me, that's different about how the practice is working. It's not about the patients and their behaviour. So go sit in a room together and learn, and just have a brief chat about how you're doing this. And absolutely last thing is, as I've said, if you don't have a digital champion in your practice, there's a lot of stuff here. There's a lot of resources available. Give someone the job within your practice of being the person who will go away and make sense of all of that for you and bring all the knowledge and learning and resources that there are available to do this stuff into your practice so it works for you. And if you don't have someone in the practice who wants to do it, maybe ask one of your patient participation group members if they want to do it. I think we've got some unlikely advocates for the NHS Act, perhaps not who we would have expected. Laura's case study there. So that was all we had to say. I think we've probably talked a bit longer than we were supposed to. But thank you to Laura, Allen and Jane for joining us. We have got questions after the session with Jasbinder. And Jasbinder, I'm glad you've been able to join us now. So I'll stop talking and hand you over. Jasbinder, we didn't get a chance to speak, so I'm hoping you're going to introduce yourself and explain your role. Is that helpful? Thank you.